and also come up with a contingency plan. And also they are making a lot of arrangements for the future prevention and control work. In the morning of 31st of July, the municipal government has organized an emergent meeting for the deployment. We have made a lot of instructions. We need all the people from Zhengzhou City to make emergent response. And when we are doing the recovering of the disaster, we have to launch the battle against COVID-19. In the afternoon of July the 31st, the provincial government organized a special meeting on prevention and control of the epidemic. The party secretary of Henan province emphasized that we have to understand the complexity of the epidemic. We have to earnestly implement the guidance imposed by General Secretary Xi Jinping as well as the CDC Central Committee. We have to make sure that we prevent imported infection and domestic re-emergence. This is our key guidance. We have to do a good job in the disinfection and also to offer the services to our local people and publicize relevant information in a timely manner. We have to guide our local people to strengthen their awareness for the prevention and control. We have to stay alert and stay vigilant and make sure that we could constantly do a good job in the prevention and control. We need to fight the epidemic to the very end. During the video conference, the municipal government of Zhengzhou once again organized another video conference to make another arrangement for the prevention and control in Zhengzhou City in order to implement the guidance by General Secretary Xi Jinping and also the regulation from the provincial government as well as the arrangement imposed by the leading group on Epidemic Prevention and Control Task Force of Zhengzhou. This evening, we are here to host the press conference on the prevention and control in Zhengzhou. First of all, I would like to give you an introduction on the speakers who are attending the press conference. They are the Party Secretary of the Municipal Health Commission, Mr. Wang Wanpeng, Deputy Secretary of Zhengzhou Municipal People's Government, Madame Li Huifang, Director of Zhengzhou CDC, Mr. Wang Songqiang, Deputy Head of Erqi District of Zhengzhou, Mr. Gao Yan. First, I would like to give the floor to the Party Secretary of the Municipal Health Commission, Mr. Wang Wanpeng. He will brief us on relevant information. Friends from the media, good evening. First of all, thank you for your coverage and your attention to the epidemic prevention and control work in Zhengzhou municipality. First of all, I would like to update you on our measures in fight against the epidemic in Zhengzhou. On July the 30th, in Erqi District, during our regular checking and the screening, we found one positive case. With verification of the Zhengzhou CDC, this case was classified as asymptomatic case. After receiving this information, the municipal government attached great importance to this issue. The party secretary attached great importance in our handling of this case. We also have other senior officials of Zhengzhou City. They also provide on-site guidance in handling the epidemic. Immediately, Zhengzhou also launched an emergent response. We start the epidemiological investigation, disinfection, isolation, and other related work to contain the spread of the virus. As of July the 30th, 6 p.m., we found 27 people show unusual results for the nucleic acid testing. After verification, 11 people are confirmed cases. All these people are with normal and light symptoms. For 16 people, they are asymptomatic cases. In order to minimize the impact of the epidemic and avoid the cross-infection and cluster outbreak, Zhengzhou City has taken a series of measures to contain the virus. We start epidemiological investigation by no time. We organize a team comprising people from Health Commission, Security Bureau, and the Big Data Management Bureau to understand how many people were infected. And right now, for the close contacts and the secondary close contacts, we have bring these people to quarantine for medical observation. And also, we are rolling out nucleic acid testing to all this group of population. Second, we also adjust the level of risk to different regions and the districts according to the requirement for the leading group of epidemic prevention and control in Zhengzhou City. In view of the actual situation in Zhengzhou City, we change the risks level to different places. Start from July the 31st, Chunhui community of Arqi district has been upgraded into high risk. And start from July the 31st, 2021, and other certain community has been upgraded into middle risk region, including the Guangxi Jieyun Huayuan community, Haiyun Huayuan community, and also number 16 of Changjianglu Street. And these three places have been upgraded into mid-risk region. And for the other places, they remain low risk. Third, we manage the group by different types and also different risk levels. And we're also rolling out targeted prevention and control measures to different places. For people who are living in the lockdown area, these people will not allowed to leave these places. And also every 4 days, we will roll out nucleic acid testing to people who are staying in those lockdown districts. And also we only allow entrance, and we will not allow any people to leave those lockdown areas during the control area. And also for some business premises and the confined spaces and other recreational places, we will close down for safety purposes. And also for the lockdown district, every 24 hours, we will roll out nucleic acid testing to all the people. And after receive the results, we will adjust the risk level. And when we are rolling out these prevention and control measures in the RT district, we also roll out massive nucleic acid testing to all people who are living in this area. And going next, we will roll out the city-wide nucleic acid testing to the whole city. Please show understanding and also cooperate with our work. Fourth, we will do a good job to build up the protection network. So for the number 6 hospital, we will stop this hospital to provide the medical services to the public. So for people who are working in the number 6 hospital, we will bring these people for centralized quarantine. And these people also report their health condition to the local community. And for people who visited the number 6 hospital from July the 16th, they also have to implement a 14-day compulsory quarantine. And right now, through the QR code information, we already obtained some big data information. We will continue to look into this information to see there are other risky groups. For people who have been visiting number 6 hospital, they have to abide by our prevention and control measures. And also for some key transportation facilities, for example, the Zhengzhou airport, the high-speed train station, railway station, and other public facilities, they have to check the health code for people who visited those places. Fourth, we appeal to the public. All the people should not leave Zhengzhou unless necessary. If they have to leave Zhengzhou City, they have to present a valid NAT report within 48 hours. And also we encourage the local people to avoid the gathering and attend large-scale activities. Right now, the epidemic prevention and control measures have been implemented in an orderly manner. Our city will conduct all of this work in a transparent manner, and also we will release all the relevant information through press conference and other available social media platforms. I hope our people can cooperate with our work and do not believe in fallacies and rumors. Once again, I would like to thank the media for your support. Now is the Q&A session. Before you raise the question, please identify your media affiliation. Now the floor is open. With CMG. So my question is how many cases we have and how many suspected cases we have in number 6 hospital in Zhengzhou. Are all these cases related to the Delta variant? Any features of this round of epidemic in Zhengzhou? Thank you for your question. I would like to invite the director of Zhengzhou CDC, Mr. Wang Songqiang, to answer your question. Thank you for your question. Zhengzhou is a key place, and also it is very important for us to prevent the imported infection. And for number 6 hospital is actually the designated hospital to receive people who are travel overseas to Zhengzhou. So earlier we do found one asymptomatic case reported from number 6 hospital. So as of yesterday, we reported 28 confirmed cases, and including 17 asymptomatic cases. Now we don't have any severe cases reported. And also we learned the lessons from the Nanjing city and the outbreak in Zhangjiajie city. At this time, if we look at the features of this round of epidemic, we found the transmission is very fast. And also we do found high viral load, and also we found some nosocomial infection for this round of epidemic and transmission. And also this round of epidemic occurred basically inside of the hospital, including some of the medical workers were infected and also some patients were infected. And this round of epidemic also shows the weakness for us in our work in the nosocomial infection. And we want to appeal for people who are working in the medical institutions to set up the 3 districts and 3 regions and 2 channels. They have to provide trainings to medics who are working in the hospital and to safeguard the bottom line for the nosocomial infection, and also to prevent the virus transmitted between human and also between the objects. We have to roll out nucleic acid testing and also to roll out the testing to people who need it the most. And we need to do our best to build up the protection network inside of the city. I would like to appeal to the public. Please stay alert and wear your mask, wash your hands frequently, avoid gathering, and abide by the prevention and the control measures voluntarily. And if you are visiting some public facilities or other places with confined space, for example, some entertaining spaces and the transportation stations, make sure you wear your mask and also to exercise decent social distancing. Thank you. Next question, please. with Phoenix TV. For this round of epidemic, the first case was found in Arqi district. And right now we are closing down some of the communities in Arqi district. So my question is, any other prevention and control measures taken in the Arqi district to contain the spread of the virus? And also we do see all of these measures have been implemented in Arqi district, especially some of the measures were taken in some communities, and we don't see many people in these places. We believe in the past there were many people in the Arqi district, and especially in Jingguang Road. In the past, we have many business facilities, and all these facilities have been closed down. And right now, I would like to understand what measures will be taken by the government to ensure the daily life of people who are living in these districts. So I would like to invite Madame Gao Yan, the deputy head of Arqi district, to answer your question. After we found one asymptomatic case in Arqi district, the district government attached great importance to this issue. We have to pay attention to people's livelihood and also their life and safety. According to the regulation of the provincial government, we have taken the following measures to curb the spread of the virus. First, we have transported this asymptomatic case to designated hospital for treatment. And also we are imposing lockdown management for the community where these asymptomatic case lives and places where these asymptomatic case visited in the past. And also we are doing the epidemiological investigation for this special case and to find out more close contacts and secondary close contacts. We also organize a team of disinfection, so they will provide all-rounded disinfection for the house and the community where this asymptomatic case lives. And also we are rolling out targeted prevention and control measures in Arqi district. We are also rolling out the district-wide nucleic acid testing in Arqi district. According to the guidance of the provincial government, we have already done the nucleic acid testing to all people who are living in the Arqi district. As for your questions, for certain people who are staying in the lockdown communities, actually we have a lot of experiences to offer services to these people. We do have volunteers and also senior officials coming from the local community. We will provide daily necessities to people who are living in the lockdown areas. Especially, we will provide services to the vulnerable groups, the elderly people, and people living under difficulties. We are making sure that we could provide this food and the daily necessities to these people. Due to the interest of time, one last question. With Henan Daily, if you look at the current situation, what is the epidemic situation in Zhengzhou is very severe. What other measures will be taken by the provincial government? I would like to invite the Deputy Secretary Ms. Li Huifang from Zhengzhou Municipal People's Government to answer your question. Thank you for your question. Start from July the 30th. For Zhengzhou City, we have already initiated the emergency response and also take relevant prevention control measures to contain the epidemic. So in the future, we'll focus on cutting off the transmission chain of the epidemic, and also we will take the most stringent measures to prevent the spread of the virus. We need to do what we can to contain the spread of the epidemic. First, we have to focus on the source of the transmission. As we understand, there are many cases occurred and found in number 6 hospital of Zhengzhou City. We have to do a massive scale of screening, and we need to roll out city-wide nucleic acid testing. And also we have to conduct nucleic acid testing to all the medics, patients, and people who are working in the number 6 hospital of Zhengzhou. And also, this nucleic acid testing will also extend it to family members of people who are living or working in the number 6 hospital. And for those who show positive results, we need to roll out a second round of testing to these people. Start from July the 16th. If anyone who have been visited to number 6 hospital, we will look into their personal information through big data. And we will roll out nucleic acid testing to those who have visited number 6 hospital from July the 16th. And also, I would like to make appeal to the public. If any one of you have been visited number 6 hospital in recent days, please abide by the prevention and control regulation of Zhengzhou. And at the same time, we are doing a large-scale screening in other medical institutions in Zhengzhou City, making sure that we could roll out nucleic acid testing to those people who are in need. We also need to strengthen our procedural management and to strengthen our weak links and to plug all the loopholes for the transmission of the virus. Second, we have to make sure the virus will not be spreading out in different parts of Zhengzhou City. We work with people from different sectors to roll out nucleic acid testing to key population, making sure that all the prevention and control measures could be implemented thoroughly so that we can build up a prevention and control shield in the communities. For hotels and other accommodation spaces, supermarkets, grocery stores, tourist sites, and places that are densely populated, we appeal these places to check the health code for people who are visiting those places. During the summer vacation, the Education Bureau also sending out notification. They have to understand whether there were some people that have been traveled to other places. If some people who visited mid and high-risk regions, they have to report their information to local communities and schools. Third, we have to strengthen our management in the airport. We have to beef up our efforts in prevention and control in the airport, and also roll out the classified management for domestic flights and overseas flights, and to bring close contacts and the secondary close contacts to compulsory quarantine, making sure all the prevention and control measures can be implemented. For the airports, high-speed train stations and the railway stations, we need to roll out nucleic acid testing to all the people who are working in the above-mentioned places. For the high-speed train station and the railway train station, as well as other key transportation hubs, we need to make sure that we check people's temperature if they are visiting these places, and these people need to present a valid NAT code and also the valid health code. Also, we need to manage the medical waste from the hospital. We also need to roll out complete disinfection to those hospitals. Fourth, we have to do our best on managing the cold chain logistics. We need to implement 4 strict measures to do effective disinfection, and also we need to do some random checking of the cold chain logistics, making sure that we could cut off the transmission chain right from the origin. And for the imported food, we also need to strengthen our prevention and control measures. And also we need to clarify the responsibility to all the relevant parties. We have to do disinfection for different packages. And also to manage the health condition who are working in the cold chain logistics sector. Also, we have to strengthen our law enforcement. For those who are not abiding by our prevention and control measures and other illegal actions, these people will be penalized and punished. And also need to do a good job in managing the risk brought by the containers, especially to the cargo transportation hub and the land crossing ports. Altogether, 5 international cargo transportation hubs. We have to do a good job to curb the transmission of the virus from those 5 above-mentioned places. Right now, Zhengzhou City is faced with severe challenge. A few days ago, we just hit by the unprecedented flooding. And right now, we are faced the challenge by the epidemic caused by the Delta variant. We all believed, with the guidance of General Secretary Xi Jinping and under the strong leadership of CPC Central Committee and the provincial government, Zhengzhou City will take science approach and take targeted measures, and all our people will be united. We have the confidence that we are capable to minimize the impact of the epidemic and finally gain victory against the epidemic. I also want to appeal to the media. Please educate the public on the prevention control measures from Zhengzhou City. Let us work together to win the battle against COVID-19. That's the end of the press conference. Thank you.